first of all, the number one hospital in California for pediatrics. And honestly, I've had friends come here and receive treatment for heart issues, cancers, had surgeries here. So I always grew up knowing that it's like the place to get good care. But on a more personal note, I really align with this mission of creating hope and building healthier futures for children. I where did my train of thought? I'm so sorry. I don't know why I just like bleeped out. But yeah, and just on my sorry, I will not do that during the interview. Yeah, and just during my preceptorship, working with the nurses up close and personal, like I said, I just really got to see how much they really cared about all the kids on the unit and how deeply skilled they were, but also just how much they really cared and took their job seriously. I felt like every single nurse really wanted to give the best to their patient. They didn't just see it as like a task to check off or like, oh, I have to go do X, Y, and Z or take care of this kid. They truly deeply wanted to learn about the kid, connect with the family, learn more about whatever disease process the baby had gone through, and really just want to do right by that child. And I admired that because that's something, as a new grad, I want to pick up from the nurses around me, and I want to be an environment that really pushes me to be the best possible nurse and just do the most for my patient instead of seeing it as just like a to-do list. But yeah, all those factors really influenced me to apply as a new grad program here.
I love that. What if they ask you why? So it's a couple different hospitals, right? Like why this hospital?
Totally. So I'll do this answer because that's the first one.
Okay.
I haven't really prepped for the other two yet because they're
Okay.
Thursday and Friday. But I think that when I really looked at the hospitals and what I was looking for in a hospital, I really think that it has everything that I am looking for. I saw that as of last month, they got their magnet designation, which is so exciting. Congratulations about that. But I know from experience working at or being at a school that has a magnet hospital, that designation really means that nurses are valued at this hospital, and just the nurse happiness and retention is something that the hospital really cares about, and that's something that I want to invest in my career as a nurse. I love that it has a nurse residency program where I can feel supported in a structured environment, especially in critical care. And then I also really enjoy just the teaching aspect of. I love that it's a teaching hospital and there are tons of healthcare professionals coming in. I think I mentioned my passion for teaching and learning earlier, and a career goal that I want to have is I want to be a preceptor and I want to teach nursing students and new nurses. That's something I think that would really bring me joy and purpose into my work. And I know that there will be opportunities for that.
If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72-question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview. So, can you please tell us why just in case they ask you as like a separate question, can you please tell us why you'd like to work at our hospital?
So I really want to work at hospital because I have actually had some experiences as myself for myself as a patient here when I was younger. I am very healthy now, so I'm sorry, hold on. I can think right now. Okay, hold on. Okay. So yeah, I've had experiences myself at hospital and the care that I received, and when I was at through the nurses especially was very compassionate, and I really want to be that nurse for other people. And also too, I really like because I know there's room to grow, and I really like the opportunities to be able to further my education with you guys. Yeah.
What do you mean by that? By just like us talking?
Because I feel like I have a lack of experience as a new grad
Oh,
and really feel like in itself, their new grad program is really great. So maybe I can mention like I've heard the
maybe
new
you
grad
can
program.
say that because when you said that, I was like, oh, does she mean she wants to be like an NP or like what is she talking
Oh,
about?
okay. Yeah, I can
Yeah.
say, yeah, I'm like, I heard the new grad program is really great here. And I'd love
Yeah.
to be able to like further my education through that and gain a lot more experience as a nurse with
Yeah,
you guys.
totally.
Okay.
And then, you could say something specific about the hospital. I don't know if it's a teaching hospital or if they have something in their mission statement that you also are like, yeah, I respect that.
Okay.
Um,
They do mention just like being like diverse and inclusive.
yeah, you can mention
So
that.
play into that. Just kind of like, okay, I really like
Mm,
how you guys are inclusive and you offer care to whoever it
yeah,
is. Okay.
yeah. Yeah, you can say that you really respect that and you're drawn to that and you'd love to work for a hospital that values that as well.
Okay.
Yeah.
So my background is actually a immunology scientist. So I do have a great EVP habit. It's almost a habit for me. Any career I work with, evidence-based practice is the basis. And how actually incorporate the evidence-based practice to improve patient safety, quality improvement, everything is just the way I work. And I really feel like I can thrive in this environment. And like I said, it was just how people care to the patient. It's something I'm really passionate about. I would love to have a family-centered, individualized care. So I would love to be part of practice, great environment for me to work in. And it's a great environment for patients to be in. So I would love to be in a part of the team.
Okay, perfect. Can you please tell us what made you interested in working here? Why would you like to join our patient-focused culture?
I was first interested in because I had a clinical there and I was really intrigued by how the unit functioned and I really felt like I was supported in all aspects. And I also know a couple of people who work for and they always brag about how well treated they are. And I know our values align with one another. And I know it really stands for providing compassionate, affordable, and cultural care. And I think that's something that I really tend to focus on and I really find important in healthcare because that's truly what it's all about. I think
I mean, if you had just said it like that was your sentence, that would have been perfect.
instead of like ending like question.
Yeah, because when you look at them like, was that good? Am I done? They're like, do I interrupt her? Like, is it rude for me to just be like, okay, next?
Okay.
They don't really know how to act when you do that.
Oh,
That
and
was
I
great.
also, yeah, and I also know, sorry, I forgot to add this in. I know is has been rated one of the country's #1 employee satisfied hospitals 6 years in a row now. So I would
Wow.
really be honored to be a part of that.
Cool. I have something for all of you that I'm very excited to finally tell you about. It's something that I've been working on for over a year. And this is great for nursing students who are just starting out. This is also great for the person who has an interview in a few days and is trying to put all of the pieces together so that they can be organized and confident going into their interview. And it is my solution to what I hear from all of these nurses that you see in these videos. They all tell me, I know something like that happened, but I can't remember it now and I wish I'd written it down. I know a lot of clinical instructors and nursing professors encourage people to write down their clinical experiences so that you can remember them later, especially when you're in front of a hiring manager interviewing for your dream job and it's something that happened, months or even years ago and you want to be able to articulate it well. It can be so valuable to have everything written down. So I've made it's a hybrid between a clinical journal so that you can save all of your memories from clinicals, but it's also divided up by question. So for example, let's say you had your first rapid response that day, you would flip to the question section that says, tell me about your most critical patient, write down everything that you can remember, while you're waiting for post-conference or whatever it is, whenever you have a few minutes. And then when you finally get that call out of nowhere asking if you would be open to coming in for an interview for your dream job that's in 2 days, you have everything organized. And then it's also a nice thing to have looking back, remembering all your first patients and the first time that you did all these different skills that you're learning. So I tried to make it all cute and aesthetic for you guys. It also includes why they ask certain questions, what they're looking for, do's and don'ts for answering questions, and then it has clickable QR codes so that you can watch examples of how other people have put their answers together who've been successful in getting the job that they wanted through their interview style. So it is about 250 pages. It's also meant to be sort of a how-to DIY version of the online one-on-one coaching for situations where you may not necessarily want to hire a coach for your answers. It is a fillable PDF. It also has other sections like, frequently asked questions, things like what should I wear? What do I do if I'm nervous? What should I put in my portfolio? I could talk on and on about this thing. I've worked on this, like I said, for over a year. I'm really excited about it. It's finally available. I do have a discount code for supporters of the channel, currently for 50% off if you use your discount code.